I wanted to talk and give an update on what has been happening in Denver, what I've seen, what a bigger commentary about healthcare and physical therapy and its place in healthcare, and then also what I'm doing with business. And it feels like a really stressful conversation to me because I believe so strongly in autonomy. I believe very strongly that no one has the right answer. I think we all have individual right answers. We all bring different things to the table. All have slightly different truths and different values, and that we all have to make the best decisions for ourselves. And I still believe that. And I think it gets more complicated when you're talking about a global pandemic and public safety. So my original thought when this all started happening was that I was going to close inclusive care. I was going to leave it open as long as possible. And I was going to close it when the hospital system that I work for, decided that we were no longer taking patients in the same capacity. I figured if this big, huge nonprofit hospital is going to pay someone to manage risk and be aware of all the CDC guidelines and keep us compliant, that I cannot compete with that. I'm going to let my decisions very much be impacted by what those folks are doing. So that's what I did. Earlier this week, Denver Health went from seeing everybody, like literally everybody, to seeing only people who were very essential. And that has continued to change department by department, and what that means to be seen changes department by department. And we are not currently a healthcare system that is overrun by people experiencing illness from the coronavirus, but it's coming. We're very confident in that, and so we are trying to do everything we can now to mitigate the risk of continuing to spread it to people that would eventually need those services, knowing that we as healthcare providers come in contact with many people, all of whom might be completely symptom-free, may or may not have a virus, and may or may not have a risk of spreading it. And it felt like shit to close my private practice. It was really hard. And this was supposed to be the busiest week that I've ever had in my business in the last year, and I had to say goodbye and hopefully see you later to it, and that was challenging. And I feel in my gut that it was 150% the right thing to do. I have had felt so much social responsibility, just that I'm so worried that I'm going to pass it to people who might not be able to handle it as well as I could, or infect entire communities. But it really is kind of this trickle-down effect, and it can absolutely spread like wildfire. And so to give that the full, I take that responsibility on personally. And I recognize that doesn't mean it wasn't a hard decision to make, and there are going to be serious financial repercussions for me personally from that. And I know that my personal finances are only a very small part of what is actually happening, right? So from my own perspective, my personal finances are an important part of this conversation because, one, a lot of people are being driven to make decisions based on their personal finances. Of course, we all are. And also because I think it's irresponsible to take finances completely out of the discussion about healthcare workers making money. Something that has been always not a driving force, but is a value of mine, is that I believe as a female healthcare provider and business owner, I should get paid what other healthcare providers and business owners get paid, right? And there is an expectation very often that healthcare providers, especially women healthcare providers, are going to just do this from the bottom of their heart, the goodness of their heart, because they're caretakers and they want people to get better and they love people and they want to see people happy. And while all of those things can be true, we also deserve to get paid. We also deserve to be financially independent. What our monetary value is should not be decided based solely on the fact that we would do it for free, right? Even if that's true. So I think it's an important thing to talk about because I don't want to take that off the table and take that out of the conversation. On another hand, physical therapists in general are underpaid across the healthcare system. You can see it if you go on the New York Times graph of like who's most likely to basically be exposed and then what they make. If you go through the different types of healthcare providers, you'll see that physical therapists really don't make that much money. And that's a whole nother discussion for why that is. And so it's also very reasonable that physical therapists want to get paid during this time and are hesitant to make certain decisions based on the finances of that, right? So all of that to say that personal finances are part of it. There's also a broader conversation about healthcare finances and equity throughout healthcare. That's not even touching like healthcare equity, or sorry, financial equity globally, right, across the board. This is just very specifically in the bubble that I know about, that I think about, that I'm living in, because that's where we are. So with that acknowledgement and that being said, I kind of live on the internet, right? And I have access to Facebook groups and Instagram groups, and not Instagram groups, but you know what I mean. People who are in the field who are trying to push the profession forward, and are saying things right now like, well, physical therapy is essential care during this time. To which I say, maybe, sometimes, right? It depends, because there's a big risk with people coming into your office. There is a huge risk that you as a provider are now passing, you're basically a vessel for the virus that you're passing on to lots of other people. Also, with places staying open, you're giving people the message that the doctor is still, like, everything is still normal. You still have to come to the doctor. Like, you still need to do, and if you still have to come to the doctor, what other things do you still have to do? I think it can be a little bit of a slippery slope, and I don't love it. With that being said, there are people who I do really think that I really worry about during this time, okay? So I really worry about people who are going to turn to drugs and alcohol to fix their pain right now, when everyone's home, in addition to their depression and their anxiety and all the other things that are also happening. I worry about patients who, postpartum patients, who are dealing, and not even just necessarily postpartum, but also moms and nurses and caretakers, teachers, who this is a time that they are more vulnerable and less likely to do things to take care of themselves. And then is that maybe acute pain now going to become chronic? I think that could be problematic. I worry about our elderly, our people of advanced age who might fall and who could be hospitalized for that reason. I worry about the people who don't typically get access to great care anyway. Are people who are still out there, who don't have access to like normal healthcare providers right now. They don't really have good access to GPs, and they may or may not have been utilizing them anyway. So I think that there are absolutely circumstances where being a physical therapist and providing physical therapy services is essential. And I feel lucky that at the hospital I continue to get to see some of those people to mitigate this the best that I can for now. The good news is a lot of that can be done via telehealth, like a lot of it, which is so wonderful to me. I find it very comforting. I've been doing it at the hospital. I've been calling people. We're not billing for it right now. We might be able to, we might not. And that's a hard conversation and goes back to the financial stuff. But we aren't just dropping people and not giving them any support and making them feel abandoned or uncertain. So I understand the concern, and it was a struggle for me to call some of these folks and like say, because I knew that I was going to make people more fearful, like, hi, this is Krystyna and Dr. Krystyna even, and I want you to know, like, we're encouraging people not to come to the hospital right now in order to stop the spread of the virus. And that really like freaks people out. People think of hospitals as safe spaces. Like, if the hospitals aren't working, what else, how can we count on anything else, right? And so I don't like that. It doesn't feel good to me. But it's the truth. And so I feel like I have a responsibility. We have a responsibility as medical providers to tell people the truth, especially about health, especially about public health. And so it was important to me to do that. I will continue to do that. It's why I'm having this conversation now, because I think we just need to generally be more transparent and be more upfront about what's going on.